Hello, everybody. I am Dr. Dan Cordalicchio. Welcome to another edition of the Suburban Wellness Group podcast. We are honored and privileged to have Dr. Betsy Greenleaf here with us today. Dr. Greenleaf, thank you for coming on. Welcome.
Thank you so much for having me on. I'm honored to be on this podcast.
Thank you very much. Thank you very much. That's very kind of you. Now, give me a few minutes. I want to go over your biography because I find this fascinating. You are a premier women's health expert, entrepreneur, inventor, business leader, specializes in female pelvic medicine and reconstructive surgery for over 20 years. You are the first female in the United States, you ready for this, to become board certified in urogynecology. That is amazing. In 2018, honored with the title of Distinguished Fellow of the American College of Osteopathic Obstetrics and Gynecology for your service and dedication to the field. Board examiner for the American Osteopathic Board of Obstetrics and Gynecology, which is always a big honor. You are CEO of the Pelvic Floor Store, online store dedicated to finding reliable products for pelvic health, and that's very important. Triple board certified. It's taken me over 30 years to get 2 board certifications. Board certified obstetrics and gynecology, female pelvic medicine and reconstructive surgery, and procedural medicine and aesthetics. You also just graduated with an MBA, right?
Yes.
And you are going for an MS in strategic management, innovation, and entrepreneurship. Where do you find time, Dr. Greenleaf?
You know, it's funny. There's not enough hours in the day. My problem is there's so much that I want to do. And like, there was not enough hours in the day, days in a year. So
you know what? I understand that. Between the obligations, between family, practice, and just life. And there's minimal amount of time to do anything. However, you are a superwoman. Look at what you have done. I mean, you know, when I first saw this, the first in the United States, board certified in urogynecology, that's just amazing. And let me just, you know, before we start, just a quick question. What was your interest in urogynecology?
You know what's funny? I kind of fell on it by accident because I was a person who was always interested in medicine, but I didn't go to medical school knowing what I wanted to do. You know, there were those people that were like, I'm going to be an orthopedic surgeon or I'm going to be a cardiologist. I knew I was interested in medicine and I kind of thought maybe pediatrics. I wasn't really quite sure. So I went through my rotations and I started kind of rating them, which ones I liked, which ones I didn't like. And I was very drawn to the surgical fields, which was interesting because I actually started off in a general surgery residency and got halfway through and realized it just wasn't for me. And you know, not to put the general surgeons down, they are great people. But what I found was that to be a really good general surgeon, you're basically a body mechanic. You like get in there, you get your job done, and you're out of there. And for me, I wanted more of a relationship with my patients. So, you know, when I would be in general surgery and walking around doing my rounds, I'd be asking people like, how do you feel now that your appendix is out? How do you feel now that you like are missing your gallbladder? And like really that didn't fit into the general surgery world. So halfway
I feel wonderful that I had an appendectomy. It's really good, Doc.
You know, so halfway through,
I want to go for another one. Please let me know what else can you take out, right?
And it was interesting because I was always interested in, I liked general surgery, I liked OBGYN, I liked urology, and I had a hard time deciding between them. So after general surgery, I went back to OBGYN. And same thing, I loved doing all the procedures. You had more relationship with the patients. Though delivering babies is fun, I actually like to sleep at night and I'm not someone that does very well with lack of sleep. And, you know, obstetrics, you can't plan when babies are coming. So it actually wasn't until my very last rotation in residency that I found that urogynecology even existed. So that it's a combination between urology and gynecology. It has to do more pelvic medicine, more so than just straight gynecology.
Right.
So, and it was interesting because when I started, it wasn't really an approved. There were some approved fellowships, but not many. And it wasn't a board certified specialty at that point in time either. So
Interesting.
It's really a very new field. It started in the 1970s. And right now there's only about 1,500 urogynecologists in the country. But we started the board certification probably, oh goodness, maybe about 6 or 8 years ago was when we first actually started the board certification process in it. So that's how I got to do it.
So that's how you came back, and then you changed again. So now this leads us to where you and I are going to talk today: gut health and how it relates to pelvic health, which is very important, especially gut health. So let's start off about talking about gut health, and let's talk about the microbiome, which is very important. A lot of research today going into the microbiome and how it affects so many different organ systems in our body. So, Dr. Greenleaf, tell me a little bit about the microbiome.
So the microbiome can refer to any part of the body. It's the natural bacteria and organisms that live either on the body or in the body. And in this case, in the gut, there's about 800 trillion types of bacteria that are in the gut. So there's so many different bacteria, and they work with us to keep us healthy. And what they have found over time is that, unfortunately, the standard American diet, which is not the healthiest diet in the world, that can throw off our gut biome. And we need a healthy gut biome for immunity, to prevent inflammation. You can develop things called leaky gut. So if we don't have nice, healthy bacteria in our intestines, you can actually cause inflammation in the intestines, which causes leaky gut, which causes, other food particles and other toxins and things to leak through the gut and enter our system and cause inflammation. I think it's really interesting because if you think all the way back to ancient times with Hippocrates, it's my favorite thing that I quote all the time, but he said, "Let food be thy medicine."
That is right.
And, I think that you can look at most lifestyle illnesses. And when I talk about lifestyle illnesses, a lot of diabetes, a lot of hypertension, some of these things may have genetic components, but a lot of it is, what are we doing with our bodies? What are we putting into our bodies? How are we exercising? What are we, doing, not doing? So a lot of this can actually be taken care of with foods.
That is so important. Yes.
I read an article recently too, is that, if you throw off your microbiome, there's always other bacteria that are going to go in there. So it's not like you lose your healthy bacteria and there's nothing. There's going to be other things that are going to take over. And they've even found that there's certain types of probiotics or bacteria that live in the gut of people that are obese that are different than the people that are not obese. And they think that these certain bacteria kind of contribute. It's kind of like a chicken or the egg, are they obese because they have these bacteria or do they have this, it's like it contributes to obesity. And there have been some studies that trying to return the gut back to its normal balance can actually help with weight loss.
Right.
So
you've just opened up a Pandora's box of so many different questions, and it's fascinating to me as somebody that's a clinical nutritionist, does functional medicine, that there could be some type of microbiome, some type of probiotic in your body that can lead to obesity. This is a very unique biochemistry that somebody has. Let's go back to the standard American diet, because this seems to be at the root cause. We talk about in functional medicine, right? Getting to that root cause. And I was reading this not too long ago. It was Mayo Clinic Proceedings. I think it was November 2019. In Spain, the children and the young adults were getting away from eating a Mediterranean type of a diet, and they were eating more processed foods. I remember it's palatable, it's affordable, and it's readily available. So you can make a quick dinner, you can make a quick lunch, eating candies, cakes, cookies, cold cuts. These are all processed foods. We could talk about wheat, soy, and corn that's in there. And that causes that inflammatory response. Can you comment on that? Because I think that's very important.
Yeah, well, we know that there are certain things, like there's the top 3 things that really, in a majority of people, can cause inflammation in the body and really affect the gut. Sugars are probably the top of the list.
Yes.
Sugar, definitely. Gluten from breads and processed, carbohydrates. And why am I blanking out on the third one? Dairy. And a lot of people, dairy can cause a lot of inflammation. So it's just that, processed foods, we were never really meant to eat these foods. I think back when I was growing up and, we didn't really have the fresh foods that were available like we do today. Like, it still kind of throws me off that I can walk into a supermarket and get strawberries any time of the year, where, I remember growing up, you could only get them when they were in season. But now, because of our supply chain, we can get food from South America during the winter, and we can, so there's just so many different options for whole foods, because the process would, it was really interesting. I interviewed a woman on my podcast. Her name was Joan Ifland, and she is an expert in processed food addiction. And she opened my eyes about how a lot of times with the snack industry, how it all started. And the history of the snack industry was that it was tobacco executives that came in and created the snack industry.
There you go. Right.
Because at the time, the argument was from these other executives, like, why would anybody want to snack? Like, people eat 3 meals a day. Why would they want to eat in between meals? And, I think nowadays you go, wait a minute, like, snacks are kind of normal in our life. And they think like people didn't eat snacks. And the tobacco executives came in and said, don't worry, you scientists invent the snacks. We will take care of the desire. We will help create that advertising need. So they actually had scientists do studies on what's the right ratio of fat and sugar that will trigger food cravings. And that's why, like, you can sit down and eat a bag of Doritos and not stop and not get full, because that fat kind of ratio and carbohydrate ratio actually triggers an area of your brain that's similar to morphine. So it's similar to addictive drugs.
Right.
So, and the fact that, we're eating these things that really our body's not processing, and is causing inflammation, and we're killing off a lot of our healthy bacteria. It's just throwing our systems completely off.
Right. And I think it's important because we're talking about, there's good bacteria and then there's bad bacteria. And I want, our audience should recognize that not all bacteria is bad. And what we want to do as functional medicine practitioners is restore that balance, that normalcy for the good bacteria. Because when we're talking about leaky gut, we're having a standard American diet. We got those inflammatory processes. Literally, the cells in the stomach, they start to separate. And you're not digesting the food. And so what happens is that inflammatory situation, that process, starts to go into your bloodstream. We can talk about diabetes, cardiovascular disease, obesity, autoimmune conditions, as well as hypertension, which, interestingly enough, are these complicating factors for what we just went through with COVID. Because the hypertension and the obesity, the hypertension and the cardiovascular disease, the hypertension and the diabetes is something that was a very bad combination. And, in my practice, we order a lot of blood work and we test to see if there's this leaky gut, because we want to take care of that. So in your world, being a urogynecologist, I'm going to say that this microbiome could lead to other different types of conditions, right? Something like a urinary tract infection. So tell me a little bit about that.
So it's interesting. So my training is an osteopathic physician. And, you know, the interesting thing, all right, let me just tell you, this is how this will all wrap up and connect. But as osteopathic physicians, we are trained to look at the body as a whole unit. And so even though I was in this subspecialty, it was very hard for me to look at patients and be like, them coming in all the time with recurrent urinary tract infections, recurrent vaginal infections. I kept on going, well, what's the bigger picture? What's the bigger picture? What else is going on in their bodies that's causing this? And that's where I got to this gut health, because we realized there's a microbiome in the vagina. And for women, the rectum and the vagina and the urethra, which is the tube you pee through, is so close, and it's very easy for that bacteria to get passed back and forth. And so not a big deal if you have healthy bacteria, but there are so many things that can throw off, that throw off your normal vaginal microbiome, and then can lead to these other conditions. I mean, if your gut isn't healthy, your vagina is not going to be healthy. So these kind of play into each other. So
they're actually playing off of each other. And besides the standard American diet, what else could cause a situation where the gut health is creating some female problems? So we know that the standard American diet, it's not the best. But what else is there that could?
Stress. Stress.
Stress.
Stress,
Who's not stressed today?
It's so funny because we're built with this wonderful system, the sympathetic and parasympathetic systems. So your sympathetic system is your fight or flight. It's when you're walking down the street, or, walking down the pathway and you see a saber-toothed tiger and your body goes, oh my God, I got to run.
Whoa.
So, and you make that decision to run before, like, your brain makes that decision for you before you can actually go, oh, hi, kitty, oh, wait, that's a saber-toothed tiger. I better go.
That's not somebody that I want. That's not a pet I want to go.
Yeah.
That point.
So when that happens, we get this flood of hormones that change. We get this flood of cortisol. And the difference is that today our saber-toothed tiger is around all the time in the form of work stress, family stress, financial stress, COVID stress, whatever stress, because our system is meant to, like, that stress to be quick happening, get us safe, and then we're good, and we're supposed to go back to baseline. But when you're chronically under stress and you're chronically kicking out cortisol, that's going to make a bunch of changes in the body. It's going to change a whole bunch of your other healthy hormones. That's going to affect your gut. It's going to add to more inflammation in the body. So it's all connected. Then you add, if you're stressed, and if you're stressed and you're not eating properly, the American diet, and then if you're not sleeping, then that's going to add to it. And then if you're not drinking enough fluids, because 75% of the American population is chronically dehydrated.
Hydration is very, very important for multiple different reasons. We were talking about this in the office. Yes, not only is our body primarily water and it needs to be replenished all the time, it's kind of like the most important, if you will, quote, supportive nutrient, unquote. But even fighting COVID, oral nasal mucosa, you want your mucus to be able to move this bacteria out of your body. And one of the physicians was indicating that if you don't have enough water, it gets crusty, and that's when the viruses take hold. Now, you mentioned cortisol. I wrote cortisol. Tell me a little bit more about cortisol, because you hear so much about cortisol. Is it good? Is it bad? What's the story with cortisol?
Well, it's good in the very, very short term because we're meant to have that system. It's the
Right.
one that gives you that like kind of burst of adrenaline so that you can get out of a stressful, dangerous situation and get to
Right.
safety. We need it. But the problem is if we are chronically stressed and our cortisol is just keep getting kicked out, what happens is, so it all starts with cholesterol. People think cholesterol is bad. Cholesterol is the mother of all your hormones. Without
Precursor, right? For a lot of different hormones.
We
right.
can't make any of our hormones without cholesterol,
Right.
a good number of cholesterol. So your sex hormones that help, with just estrogen, testosterone. We can't make any of those normal, good, healthy hormones without cholesterol. But what happens is if we're under stress, you get something called pregnenolone steal, where that system that would normally go down into your estrogen and testosterone gets stolen, and all those precursors get thrown into cortisol. Right. And eventually, if the cortisol's getting pumped out, you're going to run out. It's like a car running out of gas. I mean, you just can't keep pressing on the accelerator and hope it goes forever. Eventually, you're going to run out, and then you get what's called adrenal fatigue.
I was just going to say your adrenals are now, shot, fatigued, and so forth. And talk a little bit about adrenal fatigue, because it's I as a chiropractic physician, as you are an osteopathic physician, we look at the body as a whole, and adrenal fatigue is very important. And I think it's a condition that a lot of people have today that they don't realize it. So speak a little bit about adrenal fatigue.
Yeah. So, what happens is, a lot of people are experiencing adrenal fatigue. Adrenal fatigue may be that sensation that you're like always tired, or you go to sleep, you might be sleeping, but you wake up and you still feel exhausted. I mean, that could be your adrenal fatigue. It could be like why you're not losing weight, because your body will hold on to weight when you're stressed, or your body will hold on to weight when you're inflamed. With inflammation is a stress, so it becomes this vicious circle. So the other thing is that if you're adrenal fatigue, that's going to affect your immune system. It's going to affect the gut. I realized this actually in my own self. I heard about it, but I really didn't look into it until I started experiencing my own health problems, where all of a sudden I was in a job that I didn't really like, and I was getting stressed out, and I was being told, see more patients, spend less time, and it wasn't the way I wanted to do medicine. And then all of a sudden I'm getting sick all the time, and I go to the doctor and they tell me that I have some kind of primary immune system disorder. And I'm like, how do I live like 40 something years of my life and all of a sudden have this primary immune disorder?
And what exactly does that mean, right? A primary immune disorder.
Yeah. I mean, they just, in traditional medicine, they test your immune cells and they go, oh, your immune cells are low, or they would give you a vaccine and see if you develop antibodies to that vaccine. And I wasn't developing antibodies. And so it's like my immune system was shot. So it's a combination of being adrenally fatigued and in return, my gut not being supported, because most of your immune cells are created in the gut. And it was interesting too, because I was also developing a lot of anxiety. And I'm like, wait a minute, I'm somebody who's normally like with it and together. Like, why am I having anxiety and panic attacks? And it was finally wasn't until I go, wait a minute, what is your immune system and anxiety or depression have to do with each other? And I realized not only was it the stress and the adrenal fatigue, but your gut, because the serotonin, which is one of the hormones that makes you feel good, is produced in your gut. I had a bad diet, even though I knew better. I wasn't sleeping. I wasn't drinking any fluids. I was chronically stressed. And so, my gut suffered, my adrenals suffered, my rest of my system suffered. And that's when I started going, wait a minute, the gut has so much to do with everything. I mean, there have been people who call it your second brain. People have really, they've really connected this gut-brain axis, where we know that a lot of the hormones that are made for our brain to feel good are made in the gut. So it really is connected to so much of our other health processes.
It is extremely, extremely important, your gut. So we talked about urinary tract infection.
Mm,
Okay, let's talk about pelvic pain.
yeah.
As a urogynecologist, gut health and pelvic pain, I have a list here of different conditions I want to go over. What's the connection there? Because I find that very interesting, that your gut can cause pain in your pelvis.
Well, there's a couple different theories on this. One is that your intestines and your pelvic organs share the same nervous system.
Hmm.
So if there's inflammation going on in the intestines, it may not present itself as intestinal pain or cramping. It may present as burning with urination. It may present with pelvic pain and cramping. So that actually the nerve endings in the pelvic organs are where you're starting to feel that pain. There's especially a condition called interstitial cystitis, which is
Yes.
just, or IC for short, is much easier to say. It's an
Hmm.
inflammatory condition of the bladder that they've known about since the late 1800s, and we don't know anything more about it. But what my theory is that we're getting, there's so many different, that I could talk about forever, but there's
Okay,
one
I
of
want to
the,
hear your theory about this because
well,
I have patients that come in with this condition, so I want to learn from you. Tell me.
I don't think that with interstitial cystitis that it's a bladder condition in itself. I think that's where people are getting their symptoms, and it's
Hmm.
a sign of a larger systemic issue going on. So, because for a majority of people, it has, they tend to get better with diet. And it used to be like, oh, there's the interstitial cystitis diet, and we would tell people like avoid acidic foods. But the more I looked into this, and unfortunately with IC, it's not cookbook. It's not like, okay, you have this and do this and you get better. There's
Right.
different pathways and things to try. But I found that people, if they do the FODMAP diet, and the FODMAP
Right.
diet stands for like fructose, each letter is a type of sugar that's found in foods.
Right.
And that one is definitely gut connected, because the FODMAP diet is usually used in people with irritable bowel or inflammatory bowel
Right.
conditions. So for whatever reason, they know that people with sensitivity to certain foods like apples are high in FODMAP sugars,
Right.
that can cause gut inflammation. And so in some people, and I usually see with pain conditions, it's not just one condition, especially with interstitial cystitis.
Hmm.
It's usually they may say like, oh, I have migraines, or oh, I have fibromyalgia, or I have TMJ. Like there's other pain conditions that tend to be
Right.
associated with it. And that's why I think it's a larger inflammatory condition. So if someone has a tendency to have more bowel issues, doing the FODMAP diet may be great. But then there's other things like histamine intolerance. So
Right.
there's certain foods that contain high histamines. And actually, if you look at the traditional interstitial cystitis diet, those foods that we say are high in acids, like oranges or certain meats like beef, they're very high in
Yes.
histamine, and histamine can cause inflammation. So in
Major cause of inflammation, right?
some people going on a low histamine diet is great. The other thing, now more so with pelvic pain, like if they have something called vulvodynia, where for women
Hmm.
it's burning and pain on the outside of the vulvar area,
Right.
we often see that with high oxalates in the diet. And I will tell
Interesting.
you, I can bet money that if you were to map out those cases, you always see a spike in January of those cases. And the reason why
Why is
is
that? That's interesting.
in January, everyone has their New Year's resolutions. They all decide to be healthy, and they all start eating a lot of kale and spinach.
Oh, wow.
And,
Yes.
and kale's great as long as you don't have oxalate sensitivity, because
Right.
oxalate will build up in the tissue, and really it's actually like almost like a crystal. It can be very irritating to the tissue. So some people can tolerate, some people don't. So a lot of these things kind of work off each other. Or just in general, if your diet is high in sugars, that's just going to cause inflammation anywhere in the body.
That's right.
So or forget about, people think they're being healthy and they eat artificial sweeteners. That's probably one of the worst things you can do for your bladder and your pelvis, it's so incredibly irritating to that tissue. So,
you know, I'm not a big fan of the artificial sweeteners, and I just don't have my patience. I don't recommend that. So if you want a little cup coffee in the morning, you know, let's get some mushroom coffee and
oh, I love the mushroom coffee.
yeah, right. And you can do that. There's a couple of products that we use. Organogold is one of them. Not really a plug for Organogold, but that's one of them that we really like. So the histamines are very important into this. So there's so many moving parts to gut health.
It's crazy. I mean, it's really, and unfortunately, you know, I wish I could say it was cookbook. I could be like, oh, do this, and you'll get rid of all these conditions. But it's really,
Right.
you know, unfortunately, I've had patients have come in and they get this information, you know, it's out there on the internet, and they're so confusing that they're like living on chicken breasts and water because they're afraid to eat anything. Well, that's not good. I mean, really doing elimination diets are probably your best thing, is if you can pick a diet,
Right.
preferably, and this is where it gets hard, because I understand usually when people are uncomfortable, you know, they want to be fixed yesterday. So telling someone to go on a 12-week diet and see if they feel better or worse is really difficult. But I mean, if you can pick one of these diets and ultimately be on it for 12 weeks and keep a journal of how you're feeling, and then, you know, whatever foods you've taken out of your diet, you start adding them back in. And if it bothers you, I mean, usually when it comes to pelvic health, you're going to see a reaction with anywhere from a couple hours after eating something to 2 days later. So, you know, if you don't want to do an elimination diet, I'll tell patients, you know, just keep a food diary. And if you're really feeling, you know, crappy one day, then go, hey, well, what did I eat the last 2 days? And see if there's any kind of pattern.
Very important tool, the diet diary, because what I do in my office is when a patient comes in, immediately we have them do the diet diary. I want to know what they ate, how much they ate, how much is consumed, water, you know, soda, anything. And then I want to know, I have a little column, I want to know what you're feeling after that. See what that is that you've eaten, that you've consumed, that's going to create all of these symptoms. And I think that's a very, very important tool. Very simple tool, but a very important tool. Two more conditions I want you to talk about. Overactive bladder and vaginitis when it comes to gut.
Yeah.
Tell me about overactive bladder first.
Now, the interesting thing about overactive bladder is that it can start as early as in someone's 20s, but by time you reach your 70s, there's more people in the United States walking around with overactive bladder than has the common cold at any given time.
You're kidding me.
So it is so incredibly common. So one of the problems with overactive bladder is your bladder actually does these little spasms. And in that, patients will not necessarily feel as a spasm, but will feel as urgency and frequency. It's that sudden urge, like, I gotta go, and just can't get to the bathroom. You know, some people may leak, some people just are going frequently, some people are up multiple times a night, and those are all signs of overactive bladder. We do know that there are some foods that are specifically associated with that. Caffeinated drinks, and particularly coffee.
Is that because of the stimulation of the nervous system, if you will, and it just, okay.
And then, you know, the other thing with coffee is people are like, oh, I'll just drink decaf. Decaf is that coffee in itself, because of the acidity, can really irritate the bladder and kind of cause it to be hyperspasmodic. Carbonated drinks can do this. Tomato sauce or tomato products. Actually, the fresher the tomato, if you can grow your own tomatoes, it tends to have less of an issue because it has to do with the acidity of the tomato. Your citric fruits and chocolate. Oh, actually chocolate and alcohol. So like all the good things. You don't want to go for a nice Italian meal with your glass of wine and have some chocolate.
Well, that was, you know, growing up, you know, Dr. Greenleaf, that was probably every night in my family. Tomato sauce, a little macaroni, a little wine, and then some espresso afterwards, you know, and we were all very, very happy during that time. So, you know, in my own journey, you know, my mother, just as a little side note, my mother, after I had a cardiac event about 21 years ago, I had a heart attack. and I had to change my diet. And to this day, my mother, when she makes homemade macaroni, she looks at me, she says, "Oh, you can't eat this. You can't have the tomato sauce on it. Oh, and you're not going to drink your red wine." And I make red wine. So I said, I just make it and I bring it. It's just genetics. You know, I'm Italian American, and I
Yeah.
do a family function, and, you know, I watch everybody else enjoy it. So, you know, that's disheartening. Anyway,
But, you know, when it comes to the overactive bladder, one of the things that many people do is they purposely dehydrate themselves because they think, oh, I'm going to the bathroom, so I'm just going to not drink water. Well, that does the opposite. It actually makes it worse because the more you dehydrate yourself, the more concentrated your urine is. The more concentrated your urine is, the more irritating it is to the bladder and the urethra. So actually drinking more fluids and diluting that urine to where it's almost clear will actually help with some of the overactivity to a certain point.
And that's important to remain hydrated, because if you're not hydrated, other issues come along also, as you very well know, besides this. I mean, you know, a hot day, you know, it's a hot, humid day today. You go out and you walk and you don't have enough fluids in your system. You know, you start overheating. Something as simple as that, and that brings about problems. Tell me about vaginitis in gut health. Tell me, females experience vaginitis.
Vaginitis is basically an inflammation of the vagina, and it can be anywhere from caused by bacteria or commonly yeast. I mean, one of the problems can be with any of these pelvic conditions is the use of antibiotics in our country. You know, I know there's been a real push not to give antibiotics anytime someone shows up with a cold, but you know, God forbid you actually do have one of these conditions and you have to go on antibiotics. The problem is your gut, it can take you, if you're on a general broad spectrum antibiotic, it can take your gut a whole year to recover from that.
That's amazing.
So, which puts you at higher risk for these recurrent infections. And so the vagina has its own microbiome. And it's very similar to what's in the gut, but it has a little bit less. And it's one of the healthy bacteria that really kind of controls the healthy microbiome in the vagina is the lactobacillus strain of bacteria. And many people have heard of acidophilus, but it's not just acidophilus. In women, there's a whole range of other healthy lactobacillus. There's one called Gasseri, there's Rhamnosus, there's Reuteri, Gensii. There's a whole bunch, Crispidus, there's a whole bunch of them. So what these lactobacillus do when they're in a nice, healthy environment, their byproduct that they produce is hydrogen peroxide. And so the hydrogen peroxide is what kills off the bad bacteria in the vagina. And things can throw it off. If you're eating a bad diet, if you have inflammation in the body, if you've been on antibiotics, there's all these different things that could throw off the microbiome of the vagina. And once it's thrown off, that's where you get these opportunistic bacteria that come in and take over, and you can end up with a bacterial infection or you can end up with a yeast infection. So really, keep eating healthy, eating fermented foods, getting more fermented foods with healthy probiotics.
What are some examples of some fermented foods that people can eat?
Yeah, so there's kimchi, which is really I love it. And so it's a fermented cabbage. Usually it's Korean, a little spicy, but it's great. Sauerkrauts, but you don't want to get the canned version. You want to get ones that are usually refrigerated. Same with certain pickles. There can be pickles that are usually frozen, not frozen, I mean jarred in the refrigerated section. They usually tend to be more cloudy. Yogurt, kefir, which is a yogurt drink.
I was going to say, which is the best yogurt? Kefir would be the best.
Yeah. Oh, you know what? Just get the plain yogurt, because the problem is the sugars in all these flavored yogurts. And honestly, my housekeeper was amazing. One day she was like, "Do you want to learn how to make yogurt?" And I thought it was some complicated, process and that I needed a yogurt maker. No, I now make a gallon of yogurt every week. And I know I said dairy's inflammatory, but I kind of made
something that's homemade. It's not something that's you're not purchasing this in a box. You're not going to the store and purchasing. So it's made differently.
Yeah, so I actually my favorite pre-made yogurt is one from the woman's name, it's called Nancy's yogurt. And the reason why I like that one is because I've sat there and read all the labels and looked for the ones that have the bacteria that I want for women's health, and Nancy's comes the closest, that has the most number of like women's health probiotics. So I use that as my starter for when I make my own yogurt. And we'll take like a gallon of milk, pour it in a pot, boil it. When it cools down to where it's just warm, you just take like a ladleful or spoonful out in a bowl, mix 2 tablespoons of the starter yogurt into it, mix it up, pour it back into the pot, put the top on, and just let it sit for anywhere from 4 to 8 hours.
And that's it. There's nothing else to it.
That's it. And let me tell you, making a gallon of yogurt from a gallon of milk is a lot cheaper than buying yogurt in the store. And then once you start that, you can keep using it over and over as a starter for your next batch. So, and
because my wife is continually buying yogurt. She loves yogurt. I don't eat it because of the high sugar content. And she just loves yogurt. So we're going to have to, when we're offline, we're going to have to get that recipe over to me.
Yeah, and the fresh yogurt is so much better. It tastes so, my kids normally would never eat plain yogurt, but when you make plain yogurt homemade, it has its own kind of sweetness. It is, it's amazing.
Delicious, right?
So, yeah. And then I also make my own kombucha. So kombucha is a fermented tea, and that is incredibly easy to make too. You just boil up some tea. There's a whole bunch of recipes online. You do put sugar in it, but then you have to buy this thing. It's called a SCOBY, which is a symbiotic colony of bacteria and yeast. My family calls it the alien because it looks like very strange. And you throw this thing in there and you let it sit, and a week later you have your own kombucha, which it ends up eating all the sugar. Like people are like, oh, you're putting sugar in it. But no, it gets eaten by the yeast and the bacteria, and it creates this really tasty carbonated drink. And it, that too is easy to make when, you buy it now. It's all thank God all these things are now in the store. You can go buy them, but they're a lot more expensive. You can just easily make them at home.
Sure. What I find is fascinating about this is when you mention the traditional approach, which is an antibiotic. In a cycle of taking an antibiotic, you can throw off your gut microbiome for a year or up to a year. What happens to that gut from that medical standpoint if you are on antibiotics habitually for any type of condition? Because, and speak to that, the antibiotic, it doesn't just kill off the bad bacteria, the good bacteria is also being destroyed in this. It's not as specific, there's no specificity to this. But what happens with that, and what happens when you're on that antibiotic for an extended period of time? Because ear infections, especially in the 1990s, where the antibiotics were the first line of defense, and if it was a viral type of an infection, it wasn't going to do anything. So can you speak to that? Because I think that the audience, it's very important for the audience to know antibiotic, good bacteria, bad bacteria, as well as being on this for a long time.
I think the problem started where doctors felt the need to kind of satisfy patients. And it kind of became habit that if a patient came in with a runny nose or a cold, we were like, well, here, go take this antibiotic. So it became, it was this old tradition that kind of kept going forever and ever and ever until, I was going to say when I was in medical school, we started hearing about these super bugs because over time, these bacteria develop resistance because you don't kill off everything when you take an antibiotic. You kill off most of it, and the stuff that's left behind is resistant. Well, now it gets to the point where we can't kill off these things. So I always tell people when they think they have a cold, Today with COVID is a whole different story. I mean, if you really think you have something going on, call your doctor. But,
100%.
with a regular cold, you want to give it 5 to 7 days. And if you haven't gotten better, that's when you reach out to your doctor, because most of the time they're viral and it's going to go away on its own. And so, as long as you don't have a fever's, and even then you don't have to treat a fever. A fever's the body's way of fighting illness, because it's raising that body temperature to kill off whatever's causing this this attack. So you don't necessarily, if you have a fever, you don't necessarily want to be taking like Tylenol or Advil or just keep it down. You want to keep it up, to a certain level, but you want to notify somebody. But it's just, I think that now we're a lot more aware of the fact that, not to treat with antibiotics, and try not to treat with broad spectrum antibiotics, because broad spectrum antibiotics are like taking like a bomb when, all you needed was like a little thing to take care of it. So now with our testing, it's like, okay, find out what bacteria is causing it, find out what it's sensitive to, and really try to get on the antibiotic that it's most sensitive to for the shortest amount of time possible, so that you're not killing off all that's healthy bacteria. But, I tell people, if you're on antibiotics, there kind of is also the chicken and the egg. Well, if I'm on antibiotics and I take probiotics, am I just killing the probiotics? But I mean, you just want to bombard your system with fermented foods and probiotics. And there are some conditions like cancers, or if you're immune deficient, where you can't use probiotics, because sometimes too many probiotics, if you're immune deficient, can actually cause an infection. It's very rare, but if you're in that boat, you want to make sure you check with your doctor first. But I think, whether it's, taking probiotics, and there's so many different ones out there now. And, probiotics is an interesting thing, because a lot of people will say, well, how much? Because you go pick up, like, I know a popular one is like a line, and it's got like 1 billion bacteria. And then you pick up another brand, and it's got 50 billion bacteria. Well, I always tell people to try to go for the higher count, even though we don't have clear-cut research that says like, well, this is the amount that you need to take. But some of it's going to die in your gut. So you want enough of it to live and kind of get through. And they found that there have been some studies that show you have to take a month worth of, so say if you've been on antibiotics and say you kill off your microbiome in the vagina, that it takes a full month for you of taking probiotics or eating fermented food for you to repopulate that gut or the vagina. And that's that's not in somebody that's like killed, off where you can affect it for a whole year.
Absolutely.
So, and I think the worst thing is, well, probably one of the most disgusting thing I've seen in the hospital that works great for people, but if you kill off your microbiome so badly, you may need a fecal transplant, which I can't think of anything that sounds more gross, but there's actually where they
It's not something you want to do, is having a fecal transplant. No.
They've taken feces from other people. They're screened, and then actually it's a very hard process to become a fecal donor. There's a lot of screening that goes on, and not many people actually are able to become donors because of all the different viruses that a lot of us carry that we don't even know about. And they have to take those feces, those processed feces, and put them up from the bottom doing a colonoscopy, and they let the body kind of let that bacteria repopulate the lower gut. And not something I ever want to have done. It
doesn't sound like it's on the top 10 list of what you want to do in your life, going to see your physician. And I'd rather take the functional medicine approach to this. You're not the only physician who has said to me that, especially when you're seeing a pediatrician, and this happened in the 1990s, early 2000s, where a child comes in and they have an ear infection. It's painful. They're crying. There's a lot of screaming going on. The mom is the one who generally brings the child to the pediatrician. And God forbid if I were to do it, because, back then I would, said, all right, just, let's just give the antibiotic. because the pediatrician, I guess, is kind of underneath the gun a little bit. They want to do something to try to help alleviate. So let's try this. Everybody feels better at that point. However, that's kind of like the cause set in motion now, because even children, their gut microbiome could be tossed off, and there's a whole issues that happen with that. So I find that fascinating. I find it fascinating that there's very specific probiotics for females that would help out, that would really be very, very beneficial. Now, what about males? Is there specific ones for males that can help out?
You know what? I'm not as aware, but I'm sure there are. I mean, I think the lactobacillus in general is great. You got the Bifidobacterium lactis; those are great. So the Saccharomyces boulardis, those can help.
Have the greatest names, don't they?
Yeah. So sometimes I can't pronounce them either. So, I think that in general, I mean, I take a probiotic. I'm like, why not? So, and I eat fermented food. So I'm like trying to hit myself from all different aspects.
And I want everybody to know out there, if you are going to eat sauerkraut, it does not mean that you go to the dirty water dog on the street and you get probiotics that way. Please stay away from that. You don't want that at all. Now, when you take me through a patient, patient comes in to see you, exam, what are you looking for in an exam, and what type of tests are there that you run? And how do you look at the treatment program? How do you get that program of care going?
Typically, other than doing just a physical exam, we would always check people's urine, and I would always do a vaginal swab, because the swabs that I used actually checked for the DNA presence of bacteria. And not only that, but they would tell me if people had healthy bacteria or not, because that actually, if they don't have healthy bacteria, then I go, okay, why? And we got to try to fix getting that healthy bacteria. Right. And looking at the pH of the vagina, which is normally supposed to be 3.5 to 4.5, if it's off, that can be either one of a few things. It can be either the presence of a bad bacteria, or it can be someone who's postmenopausal and their estrogen levels are low. So sometimes actually using certain types of topical estrogens can help balance out the vagina, which will make the healthy bacteria want to be there again. Now, the interesting thing, especially with women, about urine samples, and I see them get misinterpreted all the time in other practices, is it's very difficult for a woman to give what's called a clean catch. So when you pee in a cup, it's very difficult to get a pristine urine sample that doesn't have bacteria that's washing off from the outside of the body into the cup. So, I mean, ideally, if we really wanted to know what was going on, we would take a little tube and put it in someone's bladder, a little catheter, and drain them directly of urine. But most people don't want to go with that. Right. So, I see on the other end where people are told, like, oh, I went to my doctor and I was told I had a bladder infection, but I didn't have any symptoms because their urine sample grew out bacteria. Well, here's the interesting thing that they found out is that, we talk about these microbiomes. I was always trained in medical school that urine was sterile, but now they actually know that as we age, our bladder can become colonized with bacteria, and that can be normal. So that bacteria on a urine sample without symptoms does not need to be treated. And that's one of the things, unfortunately, that we've seen is a way that people are given antibiotics that they don't need them. I've seen it time and time. And as we age, that's where I tend to see it mostly with people who are older, seniors, that they're always on antibiotics because they say, oh, I have a urinary tract infection. Well, did you have any symptoms? No. Did you have a fever? No. So really, we don't need to treat that. Now, on the other hand, where things get confusing is I've seen people have urinary tract infections that don't have bacteria that grow out in the urine. And
interesting.
That's because bacteria like E. coli, which is normally in the gut, but happens to be one of the number one causes of urinary tract infections, it can get in the bladder, and it likes to attach itself to the bladder wall. So urine samples are only testing what's floating in the urine.
Right.
So unfortunately, this is where it gets very difficult. We don't have any way right now to actually test a chronic bladder infection where the bacteria may be actually attached to the bladder wall. We don't have any kind of regulations or guidelines that really instruct us what to do. I mean, I would often go in and do what's called a cystoscopy, where we look in with a little scope, and if I saw a lot of inflammation in the bladder, combined it with the patient's history and their symptoms, and maybe they've had bladder infections in the past, then we kind of put all that information together. So, you know, a lot of times if they're having chronic infections, whether it's bladder or vaginal, we go, okay, let's look at your diet and let's see where we can improve the diet, where can we get the probiotics. And sometimes, as much as I hate antibiotics, sometimes I have to put people on antibiotics, but there's a couple ways to do it. With chronic infections, you usually try to get the least broad spectrum of them, and you can put them on low doses over a longer period of time. That actually tends to do better than if you do high doses for a short period of time. So
just like a Z-Pack, you're taking it for 5 days, and it just bombards at that.
Yeah. The ones that tend to be really horrible for the gut, and they've even been associated with, now they find tendon rupture, and they're not quite sure why tendon rupture, but Levaquin and Cipro.
I've read of that before. In my chiropractic practice, I always ask about what types of medications. Well, you normally do that. That's normal course of business. But if they are on Levaquin, you got to be careful. You are adjusting, you know, joints in your body that have tendons and ligaments. And I've read that before. So that's also very interesting. Besides a probiotic and the fermented foods, is there any other nutrients that you would recommend for pelvic health or gut health? I think that's important to know.
Yeah, you know, some people do very well with D-mannose. But with D-mannose, it's one of those, it actually is one of the FODMAP sugars. So in some people, it can cause gastrointestinal bloating. And so I would say if it does, then stay away from it. But D-mannose is basically a food for the healthy bacteria. So a lot of people do very well with that for their bladders. There are, say if you have overactive bladder, or even interstitial cystitis, there are some products out there. Like one is called Premade, which is a bladder antacid, and it just neutralizes the acidity of the urine, so it's less irritating to the bladder. But I've seen people do just as well with taking like a quarter teaspoon of baking soda and put it in 8 ounces of water. I've tried it myself. I can't tolerate the taste, but I have
it's not very tasty.
Patients that swear by it, where it just kind of chills out the bladder and helps with burning or overactivity. I like, for certain conditions, I like something called quercetin. Quercetin, it kind of acts like an antihistamine. That's one that's great for pelvic pain or interstitial cystitis.
Excellent. Yes.
L-arginine. L-arginine is good. It helps to stimulate blood flow in the pelvis, and it's great for a number of conditions, except for if you have a history of herpes virus or cold sores, because L-arginine can actually stimulate the virus. So if you take L-arginine, you have to balance it out with equal amounts of lysine.
Interesting.
And I know you had brought up one before for the gut. Was it glutamine?
So when we're looking at gut health, and we would test for the intestinal permeability, and we would do what we call a wheat zoomer test. And so when those cells start separating, glutamine in combination with the probiotics, we have found is a very powerful treatment tool where it literally helps heal that gut. And so there are products out there from different nutraceutical companies that specifically have different types of amino acids, protein, percentages to help heal the gut. And it works very well, because one of the things that I'm sure you do, and the same thing in my practice, we're always looking at the gut now. We, automatically, Dr. Greenleaf, we just go right to the gut to see what's going on there. We're going to order that blood work, and we want to make sure that they don't have that leaky gut, because a lot of conditions are emanating from the leaky gut right now. And I think that as time goes on, and I know that there's being research done at a major Ivy League college, and one of my colleagues is doing the research. And, hold on, we may have some pictures of some leaky guts, maybe at some point in time. And I think that would be very important. And I think it would help and serve humankind at that particular juncture. No doubt. Well, I see that we are over an hour right now. I could probably, Dr. Greenleaf, go on for another 5 hours with you.
I know.
I mean, there's no doubt about it. And I know that we have spoken before. You're becoming one of my favorite people. You're becoming a friend. And I want to have you back onto our podcast, because I know there's other different types of topics that we can discuss. We can educate, we can inspire people, and we can serve humankind. That's what we're here for. And any closing comments?
No, I think, you know what? It's just going back to basics. That the best things you can do for your body is eat healthy, sleep, drink lots of fluids, and decrease your stress. And those things can cure so many different health problems if we just really focus on the basics.
Right. I totally agree, and I totally understand that. And in my health journey, your health journey, that's exactly what we have done. Dr. Greenleaf, it is truly an honor and pleasure to have you on. Thank you very much. Thank you for your time. I hope everybody enjoyed as much as I did. And we will have Dr. Greenleaf on again, and we will give you some more excellent information. Thank you very much.
Great. Thank you.
You're welcome.